Mary, what is chiropractic care like been during your pregnancy?
It's been amazing. It's been really helpful with less aches and pains, and being a little bit more comfortable during pregnancy.
So Nicole was just finishing up on a Shockwave session for Mary. Mary's in her second trimester of pregnancy, and she just came off working 7 days in a row, 12-hour days, standing a lot. There's a lot more fluid, especially our extremities get a little tighter. Sometimes our pregnant population, they complain of like carpal tunnel syndrome, numbness and tingling in the hands, achiness in the feet. So what's happened with Mary is she's getting muscle cramps at night, Charlie horses, and she's got pretty significant tension trigger points. And so when we're dealing with anything that's a little bit more significant, it requires a little bit more work. I use dry needling in the acute sense for this type of a problem, but I also use Shockwave. This is radial Shockwave, and Nicole is spending time on each trigger point with a certain applicator, a tip, and she's applying pressure and percussive shock waves into that tissue, which will help with muscle tonicity or spasms. Okay, so long story short, she's using a really great tool in the form of radial shockwave to reduce tension in Charlie horses in her calves, and I'll follow up with some soft tissue work on her calf, which you'll see in a second. Prior to doing this intense treatment, I did a little bit of work on her feet and her calves, and then I had Nicole. Nicole, would you mind pulling out that other applicator? It's okay, big. This is just a nice way. There's different versions of. Did you use Atlas tip on the beginning? Okay, so you use that percussive device.
Yeah.
So that's one version, and then that little mouse-looking thing on the left-hand side is another version where you can create. Like you desensitize tissue. So people are like, I'm hurting. I don't want that on me, right? Sometimes we just got to get things warmed up a little bit and get our body accustomed to touch, pressure, and that kind of force. And that tool on the left does that for us. So you don't need to wipe it up. It's okay. Yeah. I'm gonna come in just on the side and just do some passes, and I'll show you some flash release. And I'll ask Mary some questions about chiropractic care. This type of care, right, through pregnancy, what it's been like for her. Cool, come on in. Mary, what is chiropractic care like been during your pregnancy?
It's been amazing. It's been really helpful with less aches and pains, and being a little bit more comfortable during pregnancy.
So I'm like, I'm so used to having going through the last 6 years, seeing a lot of perinatal care, and also treating my wife through the pregnancies that we've had. So it's something that's I'm accustomed to. For a lot of people, I would imagine, and what I've heard is that they're afraid of getting adjusted during pregnancy because they're afraid of the risk associated with getting adjusted, or just being something that they don't want to have to get tolerated while they're pregnant. What would you say to that as it relates to kind of like physically getting moved around during pregnancy?
I think it's definitely worth the fear of it first, because I think that's more fear than anything, but the adjustment helps you cope with pregnancy a lot easier, because the aches and pains that you don't realize that your body goes through as your baby is stretching and as you're moving around, it really helps you sleep better, it helps you move a lot easier, and also your movements are more precise. They're not like you're not leaning one end to another, and so I would definitely say it's definitely worth it. It's definitely worth the adjustment, like the daily adjustment.
Yeah. So Mary's gotten a combination of care here. Go ahead and point your toes towards Carly, and then bring your toes to your shin. Yeah, just like that. Nice and easy. Don't work it too hard. Just go like slow and point gently, and then bring your toes to your shin. You okay with that? And point. And toes to the shin. She's also seen in the second trimester the massage therapist, periodically every 2-3 weeks, and we've been focused on reducing symptoms of sciatica for her pregnancy, as well as back and bilateral hip pain. And we've had good results relative to all those areas, and now we're just kind of maintaining those results periodically with her, right, as we finish up her treatment plan with us, and really just focus on trying to create as healthy of a pregnancy as possible as it relates to her feeling good, moving often. One thing we really advocate for is a lot of strength training during pregnancy, especially on the front end, so by the end of it they're still able to kind of maintain good function and form. She's so busy, so active right now with work and running and operating a business, that she it's the opposite of what she needs, right? She needs time to recover and rest and really relax in here. So that's our direction with her when she comes in. That's based off her goals as well as my experience with this problem. Pressure okay?
Pressure's good.
So is point. And then come back up. Nice. So I work with local OBGYN groups at St. Joe's, some at GBMC that send over their patients that have back pain or sciatica. It's oftentimes a window relative to it. Sometimes we see people that have patients that have round ligament pain, psoas, tightness, tension. Oftentimes from second to third and beginning of third, because the baby grows so much during that time, patients complain of like lateral hip or glute med pain, so the edges of their hips are just achy. You doing okay?
I'm okay.
All right. Don't want to ignore you down here, okay? Point your toe. Bring your toes to your shin. Point your toe. So if we can give her that extra couple hours of sleep because her calves aren't cramping up in the middle of the night, if we can give her relief to actually fall asleep at night because she's not getting sciatica and back pain as significantly and she's getting better rest, that's a healthier pregnancy, right? If she's doing more in terms of movement and staying with her routine of healthy exercise, activities, work, right? Being productive at work, not feeling like she can't show up where it's becoming burdensome for her body to be there. I mean, 7 days in a row, that's a different story. It's a little different story. All right, we get it. You got to do what you got to do. I hear you. A lot of pressure here. So it's a healthier pregnancy, right? Like, so that's what we're focused on with her at this point now that the pain's starting to calm down a little bit more. And this is a newer thing that's cropped up with her in the last month. Would you say it's new in the last month, or you just didn't tell me about it as much?
I think it's been worse the last month. I think at first it was just once in a while, but now it's been like a daily thing.
Has it? Oh, awesome. I'm excited to see how we help you with this. Okay. Stuff. All right. Nicole's awesome. You saw her doing the Shockwave in here. She did a great job of really kind of following those trigger points and reducing a little bit of tension. I was able to get in there with a ton of pressure, which is a great start, and create some flexibility in it after she had the Shockwave, which I think is a great tool. And then, yeah, she's all set to go. So she's already been adjusted. Your low back, your mid back. We worked on your hips a little bit too. And if you are, sorry, you're like,
I think I should.
I know how to pull these things. I'm just good at adjusting people. That's the only thing I'm good for. My daughters do not run to me when they have stuff stuck in their hair. They're like, Mom, where are you? Not Dad. 1, 2, 3. Let's swing your legs this way for me. Good?
Yes.
Okay,
Okay.
awesome.
Thank you.
Thanks for
so much.
watching, and if you are interested in perinatal care, go talk to your OBGYN. Ask if there's a chiropractor in there that they would recommend. That's a great starting point. And I think that the ones that focus on that will have those relationships kind of built out, and that trust and understanding of like how we operate and what we do. So it's a great way to figure that out for yourself. Okay, good luck.